Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about dialysis prevention and care, and joining me on the program is Mr. Colvin Luthers, a dialysis patient. Welcome to the program, Mr. Luthers.
Thank you for having me.
Knowing that you're a dialysis patient, we want to talk a little bit about your life before dialysis. Tell us about that.
Okay, I was a vibrant young man. I practiced, my profession was electronics. I had my workshop in Montserrat where I extend services to the community. So that was basically it.
Okay, how long have you been on dialysis treatment?
A little over 8 years now.
Over 8
I've
years.
been on dialysis, yeah.
Okay, and what prompted you to visit the doctor for screening?
Okay, I was experiencing headaches. I had a hiccup for several days, wasn't going away. And then I decided to check with the doctor. At that time, they discovered that my blood pressure was very high. And on further checks, found out that my kidney was not functioning properly, actually. Actually, they diagnosed that I was at stage 5 at that
Stage 5.
time, yeah.
What was that experience like hearing about that diagnosis?
Hearing about the diagnosis, I didn't have no experience about it, didn't know where it would have led me. I was oblivious to the whole extension of the thing, dialysis and everything. But then after researching, I realized that would have been a drastic life-changing situation. To begin with, where I had to walk away and leave all my work, my house, the whole life behind me. It was complete change, actually.
A complete change indeed. You would have mentioned high blood pressure. Was this something that you would have experienced for a number of years?
Yes, I was diagnosed hypertensive a couple years before. But the issue with me is that I never take it seriously. I never continue to take my medication as prescribed by the doctor. And I think that is what led up for me to being in a position where I am at present.
Following your diagnosis, what steps did you take then? I know you mentioned earlier that at the time before your diagnosis, you were stationed in Montserrat, where you had your business and house and family and all that. What happened after that diagnosis?
Well, actually, I came to Guyana to have a second opinion because the island doesn't have the resources to handle such cases like mine. And there's where it was confirmed again that I'm suffering from chronic kidney disease and I require dialysis. So I have to leave everything behind and just, I'm back home here now, taking treatment 3 times weekly. A lot of challenges, but you have to be strong mentally.
Definitely. You mentioned dialysis, and I did too. But I'm sure there are persons who are listening and watching the program, and they're not too au fait with what it is and how it is done. From your experience, tell us what being on dialysis treatment is like.
Okay, first let me explain what dialysis is. Dialysis actually is a replacement for the functions that your kidney does. So basically, you go on a machine, you spend most people 3 to 4 hours, and the machine actually cleanses your blood of the toxins. That's the duty that your kidney should have been doing. It also helps the kidney to get rid of the fluids, the toxins in. That's where you will normally urinate and excrete toxins. The machine also does that for you. So that's basically the functions of, or what I will explain what dialysis is.
You mentioned that being a dialysis patient, you would have experienced so many different challenges. And I know there are persons who are watching the program and they may have family members too who are on dialysis. Tell us, what are some of those challenges like? What are some of the struggles that you face on a weekly basis and even daily?
Okay, you're not 100%. Even after dialysis, their incapabilities. Probably a lot of people just basically walking, doing basic things for themselves. There are a lot of aches and pains due to treatment, a lot of side effects, headaches, tiredness, dizziness, because you got to use them. Sometimes a lot of people use different medications according to what caused the kidneys to fail.
Yes.
And those things have side effects. You know what I mean? For instance, dialysis patients will come across some people as lazy because we tend to sleep a lot. A lot of tiredness, a lot of, but that's just some of the side effects of the treatment and the disease itself. So I will ask a lot of family members to be patient, to read, to understand the sickness and the many side effects that comes with it, and give that patient 100% support, because that matters.
Indeed, support is very much important, and I'm glad that you touched on that area because there's so many persons who are out there and still not aware or understand what it means to be a dialysis patient and the kind of support that is needed. So I'm happy that you would have shed some light on that. As part of some of the challenges experienced, how has being a dialysis patient and your diagnosis shaped or changed your social life? What is your physical activity like on a daily basis? I know it has been a total life change because there are some things that you cannot do like others, but how has this shaped and changed your life in this aspect?
Drastically. On the physical part, I think in the beginning there are minimal changes to some people. Some people, they just go totally out of it. And you will find from day to day, even as you prolong, there's certain things that you definitely can't do that you used to do. For instance, jogging. I started out jogging a lot, right? Just to get back my physicality in thing. But then I had to stop. Constraints, and I had to stop on that. So it's a big change. It's a big change. It's, what I mean? Just being mobile, just moving around,
It's challenging.
It's challenging, yeah.
What about your diet? How has that changed?
Well, there are specific diets for dialysis patients. It varies depending on what cause your thing. Definitely water retention. A lot of people have to watch their water intake. Some people can drink a little bit more than some. High potassium foods, a big no-no. So the fruits, basic thing like fruits, you have to watch how some fruits more watery than some. So everything is I believe in portions. Yeah, I believe that everything is about portions, knowing yourself, knowing your limits, and trying to live within that little bracket. But dieting is important, less oily foods. Where the doctor would normally tell a healthy person to try to stay away from, the same thing goes to dialysis patient. We have to be more strict. Alcohol, smoking, He would tell a normal healthy person to, abstain from those things. Well, likewise for dialysis patients, those things are no-no, if you would like to live a little longer.
Longer life.
A little longer life, yeah.
Thank you so much, Mr. Luters. We're going to go into a break and be right back.
My name is Baldeo Singh. I'm a senior medical registrar attached to the Georgetown Public Hospital Corporation. I'm working in the nephrology department, and today I'll be talking about chronic kidney disease. So, what is chronic kidney disease? Chronic kidney disease is basically when you have impairment in your kidney function that lasts for more than 3 months that did not return to normal. This can also be further defined by looking at your urine analysis as well as an ultrasound that shows that there is impairment in the structure or the function of the kidneys. The main risk factors to develop kidney disease worldwide, the number one cause is diabetes, and this leads to diabetic kidney disease. There are two types of diabetes, type 1 and type 2. However, the rate at which you can develop kidney disease varies according to the type of diabetes. So sometimes a patient with type 2 diabetes can be diagnosed initially at the beginning of the disease with chronic kidney disease. However, in type 1 diabetes, it takes at least 12 to 15 years to develop diabetic kidney disease. Other risk factors include other diseases such as chronic glomerular nephritis, and this is most of the time secondary to a disease we call lupus. There are other specific kidney diseases that can lead to chronic kidney disease. There is also diseases that can arise from having kidney stones after a long time that can lead to chronic changes in the kidney, especially those that cause obstruction where you go to see a urology doctor and you have to get stent in and so on, if not controlled appropriately. So kidney stones as well as a major risk factor to develop CKD if not treated correctly. In the elderly, especially above the age of 70, they tend to have a lot of joint pains and muscle pains and so on. So they tend to use a lot of what we call NSAIDs, which are pain medications, excluding paracetamol or Panadol as commonly known. So medications such as ibuprofen, diclofenac, Zerodol, according to the brand name. These medications, after using for a long time, can lead to something that can cause changes in the kidneys as well and lead to chronic kidney disease. There are other risk factors that can also add to these, including smoking, drinking alcohol, obesity, hyperlipidemia. All of these contribute to cardiac disease as well as kidney disease. So overall, the number one cause or risk factor for kidney disease or chronic kidney disease will be diabetes, followed by hypertension. What are some of the common symptoms that patient may experience? So there are 5 stages of chronic kidney disease. Stage 1 and stage 2 most of the time are asymptomatic. You might not feel any symptoms. However, as the kidney disease progresses to stage 3, stage 4, stage 5, you start to have symptoms. So the most common diagnosis that you'll find as a symptom would be anemia, followed by hypertension, and sometimes there is something we call changes in the bone mineral disease in your body, which will cause a low calcium and a high phosphate level in your blood. So the most common symptoms of anemia would be fatigue and tiredness, especially on exertion. And that's basically, anemia is a low blood count. Your hemoglobin will drop from the normal value to a lower value. And then your blood pressure will start to be very uncontrolled and maybe hard to control with your normal medication. So that's when you will need to seek specialist attention. In terms of the other things that can happen with the bone mineral disease, where calcium goes low and your phosphorus level tends to be elevated in your blood, you'll have to be placed on calcium supplement with vitamin D3, as the kidney works on the metabolism of vitamin D3 and calcium, as well as your phosphate. So as the kidney gets worse, these things are affected in their metabolism. As the disease progresses to stage 4, stage 5, that's when you start to have swelling in your legs, start to become short of breath, especially when it's at stage 4, ending of stage 4 or stage 5. You may have symptoms of loss of appetite, itching in your skin. You may have nausea, vomiting, and then you may become very sick and need to be hospitalized. So before you reach to all of that, the ones that I've mentioned before, you will experience before you reach to stage 4, stage 5.
Mr. Luthers, I know you would have traveled from Montserrat to China and you would have accessed treatments, and you're here in Guyana, where you're residing right now. Could you tell us, how has the Guyana health system impact you over the years?
Well, I must be thankful because moving from one where there wasn't any access to dialysis and kidney treatment, I'm here in Guyana where, I'm fortunate to be home where I'm accessing those sort of treatment, Apart from, I've seen it grown throughout the years. I've seen things gotten better throughout the years, and I'm thankful for that.
You're thankful for
Yeah.
that. I'm happy to hear. The ministry has been stressing the issue of prevention, and we know that there are many people out there that are not, visiting their health centers in the various communities and so on. What would be your encouragement to them? I know you would have mentioned earlier that one of the areas that you struggled in was keeping up with your medication and so on. What would be your encouragement to persons who are not going to get screened, who are not paying attention to their health?
I will like to stress on that actually because I think prevention is better than cure.
Indeed.
So I would like to stress on people to go to their health centers, especially those that have chronic disease, for instance, diabetes, hypertension, to follow up with their treatment, to follow up with their appointments, because these are the two major things that leads to kidney failure or kidney disease. So taking your medications for hypertension, taking your medications, a matter of fact, go take a checkup. Go have a check, see what's going on with your kidneys. Go check, see what's going on with your body. Check to see that you're, to prevent meeting to this stage. So I will encourage anybody that is suffering from any sort of disease to check in with their doctors, check in with their health centers, and to pay keen attention on their medication actually.
Thank you, Mr. Luthers.
Okay then.
How can chronic kidney disease be diagnosed? Well, for one, it would be it can happen at any age. It can happen in the younger population as well as the older population. However, given that the most common risk factor is diabetes, and diabetic patients should have at least a checkup every 6 months, which includes a creatinine, which is one of the tests that test the kidneys to see how the function of the kidney is going. It's a blood test that can be done, and if you're stable, you can have it done once yearly. If you're uncontrolled hypertension, uncontrolled diabetes, you can have it done every 6 months. The creatinine will give us an indication if there's any issues with the kidney, as well as you can have a ultrasound of the kidney to check the size and the structure of the kidney, as well as a urine analysis. So what is important is that protein should not be in the urine normally. However, if there is protein in the urine, especially if you're diabetic or hypertensive, that's indication that there is some changes going on in the kidney and that you may have a form of chronic kidney disease. So those will be the most common tests that can be done. A creatinine, which is a blood test, a urine analysis, which checks your urine mostly for protein, other things as well, but mostly for protein, as well as a ultrasound looking at the kidneys, the size and the shape. how can we prevent chronic kidney disease? The one way to prevent it will be to know that you have a diagnosis of chronic kidney disease and to prevent the progression of chronic kidney disease. There are 5 stages according to the KDIGO classification, and as you progress from stage 1 to stage 5, it gets worse. So to prevent it, especially if you have diabetes or hypertension or any chronic disease, it's good to get a checkup at least once yearly with blood work that checks for your creatinine. And when you do check your blood work, you should have a doctor review your investigations. The other thing would be to have a healthy diet, so that would be low salt, low carb diet, as well, especially if you're diabetic, and to have a healthy lifestyle, which includes exercise, at least 30 minutes 3 to 4 times per week, which can be brisk walking, running, or cycling. So the prevention of chronic kidney disease is basically in keeping with all other diseases such as cardiac disease, stroke, hypertension, which is based on your diet, exercise, and controlling your underlying disease, especially diabetes and hypertension, as well as seeking consultation from your doctor on a regular basis. In terms of what is available in Guyana, so the stages, stage 1 and stage 2, and even up to stage 3, can be treated by a primary healthcare physician, which is most of the time the doctors are located at your, if you're in the public system, in the health centers. If in the private system, you can see them at the hospital or the private clinic. Their treatment will be basically targeted towards controlling the cause, or for example, if you're diabetic, controlling your diabetes, placing you on the right medications to treat your diabetes that have benefits over the kidney as well as the heart. If you're hypertensive, controlling the hypertension and putting you on medications again that would be beneficial for the kidneys. And one of the groups of medication is called ACE inhibitors. For those who know these medications, would be things like captopril or ramipril. But excluding captopril, mostly like ramipril or losartan, which is very common in the community. And the other thing would be, if you are stage 4, stage 5, then you should see a nephrologist, which if you go to your clinics, they can refer you to Georgetown Public Hospital to the nephrology clinic, and you can be seen there by a nephrologist.
Let's now hear from Dr. Leslie Ramsammy as he tells us a little bit about World Kidney Day 2024.
Every second Thursday of March each year, we observe World Kidney Day. But we have very little reason to celebrate World Kidney Day. So we will stick with observing World Kidney Day, hoping to bring attention to a major public health problem. Each year, more than 10% of the global population is impacted by chronic kidney diseases, what we call CKD. And those persons living with CKD suffer from disability, premature deaths, and indeed CKD is one of the world's major disease burden. But increasingly every year, we have what is now called AKI, or acute kidney injuries. I would like to call on public health agencies, ministries of health, WHO, the US CDC, and other public health entities to up their game. We need more attention on kidney diseases. It is a major public health problem. But just like HIV in the 1980s, we continue to neglect this important problem. And here is the crux of the matter. Not only does kidney diseases affect people's health, bring about premature death and disability, but it serves as a multiplier effect. It makes heart diseases worse, it makes diabetes worse, and therefore it is a public health problem that we need to focus more attention on. Guyana has recently upped its own game when it comes to kidney replacement therapy. This is what people generally know as dialysis and kidney transplant. We have become the leading kidney transplant country in CARICOM, and in 2024 we are expanding the program and making it a center of excellence. We also have increased access to dialysis for citizens around the country, and the government provides every citizen in need of dialysis with a subvention of $600,000 annually. This does not include the testing that we provide for each patient, which brings the subsidy to more than $1 million per year. But kidney replacement therapy, such as dialysis, such as transplant, is the last resort. We have to ensure that we identify people with kidney disease or at risk for kidney disease early. And therefore, testing like HbA1c, albumin creatinine ratio, etc., should not only be for those who are already sick, but we should identify populations at risk and test them regularly. It is for that reason that tests like HbA1c and albumin creatinine ratio, which is reserved for regional hospitals and tertiary care facility, should be at the primary healthcare facility. And the reason why Guyana's package of healthcare services now is trying to bring these tests at the level of the health center. Traditionally, people with hypertension, diabetes, etc., who are at huge risk for CKD and for AKI, have been treated with medicines that we've been using for the last 20, 30 years. Antihypertensive, for example, remain the same medicine that we've been using for the last 20, 30 years in all the developing countries. In the meantime, the developed countries have moved on to revolutionary new regimes of medicines. We have heard of these medicines, the so-called SGLT1 and SGLT2 medicines for diabetics that are revolutionizing healthcare, cardiovascular disease, obesity, etc. Medicines such as Jardiance and Ozempic that have become everyday medicine in developed countries. Guyana is already investigating the possibility of moving these medicine into our regular medicine regime. So Guyana is moving forward. We are adopting revolutionary new approaches to kidney health. The WHO must lead a global revolution. These medicines are too expensive. We constantly and consistently return to the old system of inequity, where developed countries have access to modern approaches, testing, diagnosis, treatment that bring better health to their people, whereas developing countries must wait sometimes for 10, 20 years before we have access. This global inequity must stop. And that is why this year, on World Kidney Day, the team Kidney Health for All is expanded to include equitable access to testing and medicines. We must end the inequity now, and the WHO must lead this process. But in Guyana, we're not waiting for the WHO to lead us. We are moving to first world approaches to kidney health, but we are adding our own dimension. We want kidney health to be in every home in this country. We want every citizen to know about kidney health. We want no one left behind. Everyone with kidney disease must get access to modern medicines and modern testing. Nobody should die of kidney disease in our country. Please pay attention to World Kidney Day 2024, and let's make every day World Kidney Day.
Thank you for joining me on the program today. I'm Alicia Martin saying goodbye for now.